Residents have a chance to get healthier thanks to a multi-million-dollar federal grant to the county health department. The program is called Making Healthy Happen, and it's encouraging us to exercise more, eat healthier, and set good examples for our children out there. CBS 4's Maribel Rodriguez has more.
This is the first time in the history of public health that we've been able to receive these dollars that will permit us to do this, so we're very excited.
Dr. Lillian Rivera is thrilled knowing that Miami-Dade has been rewarded with a $14.7 million grant from the federal government that will change thousands of lives.
We have a great strategic plan where we're looking at which covers anywhere from policy changes to system changes to creating special environments in the community so people could have access to healthy foods.
And Dr. Rivera, the administrator at the Miami-Dade Health Department, who is in charge of the grant titled Communities Putting Prevention to Work, will make sure all those plans are carried out while tackling serious issues in our communities.
Our major causes of death in Miami-Dade County are heart disease and also diabetes.
Another major issue is childhood obesity, and because of that, the Miami-Dade Public Schools is one of the beneficiaries of the grant.
How great is this for Miami-Dade Public Schools and then for obviously the students?
Well, it's fantastic, Maribel, because the whole point of the grant was to change the environment. It's the communities putting prevention to work. The Miami-Dade County School District has been at the forefront of wellness policies for some time, and with this grant, we've been able to take it up a notch.
Maribel Rodriguez, CBS 4 News.
And joining me this morning is Dr. Lillian Rivera, administrator of the Miami-Dade Health Department. You just saw her in that piece right there. Welcome to the show this morning.
Thank you so much. Thank you for
Well, let's talk about this. Make Healthy Happen Miami. What is it exactly for those that don't know?
That is the name of our program. We received the CPPW grant that was mentioned in the spot. Those were the $14 million that came from the federal government. But right now we coined our program, Make Healthy Happen Miami. So with this multifaceted program, we're going to be doing a lot of things in the community to be able to improve our environment and improve policy.
And why is it so important, Lillian? It's
important because the obesity rates have been going up not only in Florida but in the nation dramatically over the years. We're having children with already chronic diseases such as diabetes and hypertension, and that is very, very, very scary. Obesity is a #1 issue that we need to tackle, especially in the children. We have to stop the trend.
And I think stopping the trend is starting early with many of these kids. As you and I were speaking off camera, I've noticed kids as young as preschool learning about gardening, learning about nutrition, and then being able to go home and tell their parents about it. And so it seems to be working.
Absolutely, you're absolutely correct. That's the greatest time to teach the children good nutritional habits, good exercise habits, because they do go home and talk to grandmother, or talk to the aunts and uncles and their parents, and sometimes say, listen, I think what you're eating has too much salt or has too much sugar. Why don't we try this? And then they themselves, those habits stick forever with them.
That is true. Now, let's talk about some of the goals here for the program and here in Miami-Dade County.
Okay. Well, definitely we want to do it a multi-dimensional approach to all of it. So it's very important that our community partners are involved. So we have many, many organizations that we have been able to give this money to. And obviously the health department monitors all of the planning process. But we have initiatives in the schools, for example. We have what's called healthy vending machines for the children, and we work this very closely with the school system. We have educational programs for the teachers. We have changes at the child care centers, changing their nutritional plans to make sure that the children that are taken care of in the child care centers receive good nutrition while they're there. We're working with the hospitals to start breastfeeding early. We're working with community gardens. We want that in each convenience store that we have in the inner cities that have food deserts, that people can access fresh vegetables and fruits, because we don't have that right now in the local communities in our urban area.
Very true.
So we want to change that. We want to change the environment.
When are we going to see whether or not this is working, whether or not this is really having an impact and making a difference here in our community across Miami-Dade County?
Well, some things will be immediate and some things will be long-term, but definitely right now, the participants of the program in many of the initiatives that we're doing right now, you interview them and you see the changes in the children. You see the changes in the adults that have been impacted by this program. They are learning better habits. They are learning that exercise is such important to be incorporated within their day, and just making small modifications in their lives. And we are working with politicians because where we live, play, and learn makes a difference in your health. So the politicians are helping us understand that there needs to be some changes in policy at the county level to improve the health of individuals.
Now, where do you go from here? This is the first year of the program, right?
That is correct. We have another year to go, and then we are applying for the second phase of the grant with our consortium, a consortium for a healthier Miami-Dade, and through our health council, and hopefully we'll get that one and continue 2 more years. So we'll have 4 full years, hopefully, of many, many of these interventions, and we will make healthy happen in Miami.
How can I get involved, or how can I help? How can I, make sure that my child is actually learning more and getting the nutrition that he or she needs?
The health department is open to information at 305-324-2400, but we have our website, dadehealth.org, and we are coming up with a specific website, which is Make Healthy Happen Miami, which we're going to launch very, very, very soon. And people will be getting all the tidbits right there, what to do. But within their school system, their child care centers, you're going to see the imprint of Make Healthy Happen Miami all over, because we want to make it a very successful campaign.
Now, I have to ask you this, with all the cuts that are going on out there, with everything that's being cut within the school system and everything else, because they do have these gardening programs within the schools across Miami-Dade with certain schools. So will they stay? Will they be there? Is this only something that these kids are going to go through? They're going to learn for 1 year and maybe 2, and then it's over?
Within the grants, we build what's called a sustainability track. We have to sustain these type of practices. So we are building a hardwire system into all of these institutions to make sure that the messages continue and the education continues to be deployed and the changes in policy are permanent.
All right, Lillian, thank you so much, and we wish you much success. It is great, though, because I know I'm a witness to watch these kids learn from this program.
Absolutely.
I mean, young kids.
Absolutely.
All right.
Absolutely. Make Healthy Happen Miami.
Make Healthy Happen Miami. You got it.
Thank you.
Thank you so much.